we'd like to take you through this segment called Colon Cancer Awareness. And of course, this being Colon Cancer Awareness Month, on set we have the first Vice Chairman of Trinidad and Tobago's Cancer Society, Dr. Asante Le Blanc. Welcome.
Good morning. Thank you for having me.
So we are discussing the FIT test being offered by the Trinidad and Tobago Cancer Society. Is this a new strategy? Is this a new way forward?
The fecal immunochemical test, which is just the FIT, it's not brand new, but it's something we decided to launch at the Cancer Society because it can be used as a screening test, especially in low-risk individuals. What does that mean? Colon cancer's risk factors, so the high-risk individuals are those with genetic factors, hereditary factors, for example, first-degree relatives that have died of colon cancer, have been affected by colon cancer, familial polyposis, which is a lot of polyps, and that could be hereditary. Those high-risk individuals, we will automatically go to the gold standard screening test, which is the colonoscopy. But then, like you and I, we could be normal, low risk, no family factors, no risk factors. We exercise, but one day we wake up and we find we're feeling more fatigued, we're losing weight that we shouldn't be losing, and we're just not feeling right. And when we do the workup, the FIT will look for occult blood, so hidden blood in the stool. And that is then our workup to then take you to the colonoscopy.
Okay, and how accurate is this test compared to other colon
It's fairly sensitive. It's a very sensitive test. So it's just the guide, because a colonoscopy is very expensive, but it's the gold standard screening test for colon cancer. But we had to find, something had to be found so as to do proper screening, if you know what I mean, that's accessible and that everybody can access, economically speaking, so that we know not everybody is going to go do a colonoscopy at 30, you know what I mean? But if you find a hidden blood, then there's a workup to be done, and then that might take you to be early diagnosis of a colon cancer, because we didn't suspect you at 30 to have colon cancer, but guess what? If we did the FIT, found a hidden blood, then we know, okay, colonoscopy, and we might find something earlier and therefore save your life.
Would the FIT test now be included in your usual annual checkup by the doctor?
Again, that is an individual conversation with your physician, but I would generally say, like, I'm a primary care physician, and we would generally look at individuals once they hit 40, 45, to include that in your general checkup, because and we've been doing it. There was another test, which is just the occult blood, but this is now an immunochemical test.
So what's the difference?
I think this one, well, I don't think. This one is more sensitive and has more immunochemistry involved. And so we're looking, they've just, I guess, gotten it better with time, with technology. And therefore, I would give my patients the option, once they're doing an annual executive medical and stuff like that at 40 and upwards, based on your interview with the patient and how they're feeling, as a physician, if it should be suggested to that patient.
How costly is it?
It's only $115 at the Cancer Society. As you know, our services are heavily subsidized because we want to allow access to healthcare, to screening, to the whole population of Trinidad and Tobago. So it's $115 at the Cancer Society. And it's not as it sounds. I mean, when people hear fecal immunochemical test, we know what we're doing, right? We're getting your stool. So people are a little, I don't know about that, but it's very simple. We give you the container, you collect it at the Cancer Society, all the instructions are there. You don't even have to touch your stool. The days of that, it never happens. You flush the toilet, make sure it's clean, you have a bowel movement, and then we have an applicator there. You take the sample, you put it directly into the container, and that's it. You fold it up in the bag and you bring it back to us.
You make it sound so easy.
But it is, and we have to get over the stigma of these are natural things in our body, and this is saving your life. So you have to really get over that, and it's cheap, it works, and at least it will guide us, as physicians to your health.
How new is it to Trinidad and Tobago?
They've been doing it for a while, for about a year or so in Trinidad and Tobago, but the Trinidad and Tobago Cancer Society decided that since it is one of the possible screening tests for colorectal cancer, we should launch it, and we should make it more affordable to the public.
In terms of accessibility, where else is it available?
Private institutions.
Okay, not your regular health centers and that kind of thing.
Not to my knowledge, not as yet, because it still involves a kit, and so I know that some private institutions offer this test.
Okay. How often should you get to this particular FIT test?
Every year.
Every year,
annual,
so
yeah, you know, but
once, of course, you
once,
said
yeah,
your
you know, because you have to look at
physician.
the patient. Are you feeling, you know, are you feeling fatigued? Are you seeing blood when you wipe? You know, are you feeling more alternating constipation with diarrhea? You know, are you just not feeling yourself when it comes to your digestive system? And if that's the case, and you have that discussion with your physician or with the Cancer Society, we can always help you along that way.
How prevalent is colon cancer in Trinidad and Tobago?
Yes, colon cancer is actually the third leading cause of death for cancer in men and the fourth in women. So it's very prevalent. So it's one of our leading causes of cancer deaths in Trinidad and Tobago. So we have to recognize that, and we have to do prevention, and we also have to do screening for early detection.
I want to talk about preventative measures, but before I do so, hidden blood in stool. What exactly? How do you have to look for the blood in?
Well, that's why it's immunochemical. So we have certain markers that will detect and react with the hidden blood, because when the blood is in the stool, you may not see the bright red blood, and it's broken down, and it's the heme of the hemoglobin, really. And it's broken down, and so we detect it with the immunochemical test. So it's very microscopic at
But
that level.
can it also be mistaken for, I can't remember, is it biles or piles?
Bile?
Bile.
Or piles,
Piles, yeah.
hemorrhoids. That's what you're
Hemorrhoids.
talking about. Well, the thing is that bleeding with hemorrhoids is usually not hidden. Bleeding with hemorrhoids, you will wipe and you may see blood, or when you pass the stool, you may see blood outside of the stool. So generally that is the bleeding you get with hemorrhoids or piles.
So you can't really mistake it.
The
Both of them
piles,
can be mistaken
no, you can
necessarily.
mistake the hemorrhoid bleeding, the colon cancer bleeding for hemorrhoids, but not, it's very unlikely the other way around.
So
But
it's,
any blood you see
yeah, it's
in your
definitely a
stool, yeah,
cause for
you need to go to your
concern.
doctor.
Now, is it preventable? Is colon cancer preventable? What can we do to prevent it?
When we say preventable, because it's obviously a lifestyle disease as well, because it's cancer. It's one of our chronic non-communicable diseases. So we have the risk factors of genetics. So that you can't prevent, your genetics or your genetics. But then we have our lifestyles. So we come back to the basics again with the exercise, always. Those are the cornerstones of health. And then we come back to how we eat and what we eat. So people, there's all sorts of myths out there, but it's about balance. And we've talked about this before,
Yes,
in
we
terms
have.
of a balance with your red meats, a balance with, and avoid the excessively preserved foods. Eat properly, eat the vegetables and the fruits that are local to us. You know what I mean? Go back to what we grew up on. And we as a I hate the word third world, but I think we should, developing world, our developing countries, we need to not be ruled by the developed countries. I mean, and I'm not political, but I think I'm so tired of us always losing our traditions to the developed world. And we eat well. We used to eat well.
used to eat
You know what I
well.
mean? You used to wake up and you had your good, fresh breakfast,
yeah.
and,
Fruits.
everything. You had your fruit trees in your yard. You picked
Yes.
your mangoes, your oranges. But where is that? So a lot of life has changed, and I think we have to, as a nation and as a people, get back to that. I'm not saying say no to things that have changed. All of us like cheesecake. All of us like chocolate cake. But let us kind of keep some of our traditions alive, because those were healthy traditions.
We've been cutting down our Dewey mango trees to make room for tenants.
And do
to
you know
put our
what's
buildings for
happening? That
tenants.
when they tell us, we allow the developed worlds to tell us what was bad for us. Our coconut oil was bad for us. Our this was bad for us. The ghee was bad for us. And then they went and they marketed it. And now
We're coming
we
back.
are
All of
now
a sudden it's in
paying
demand.
for things we used to make. So, this should be a lesson in our lives that we need to really think when somebody says to us, this is bad for you. We need to say, really? And really think about balance and try and eat properly. And according to what we are accustomed to, we didn't grow up on foreign foods,
Right. And my final question, what are some of the symptoms of colon cancer? And then your closing comments.
Right. The symptoms of colon cancer are very general in the beginning. So it's fatigue, weight loss you can't explain, alternating constipation with diarrhea. So some days you're constipated. And please note, constipation is not that you go to the toilet once a day. Constipation is when you don't go every day. People
Okay.
think that they should go to the toilet 3 times a day. And if they don't, they're constipated.
But it's a good thing if you can use the bathroom 3 times a day, isn't it?
It's okay, you know. Your body is programmed for once to twice. So,
Okay.
you know, 3 times is not bad. It's not a bad thing, but it depends on the quality of the stool as well.
Right, yes.
You know, look back. I always tell people look
Look
back,
back.
because the shape of your stool
Yeah.
is important, and those are signs for us, because sometimes they come out like a ribbon, or sometimes they come out like gold pebbles, and that is important information for your doctor, because then we know what workup to do. You
Yeah.
understand? You feel unwell, you feel gassy, you feel like you've emptied but you've not emptied. These are signs and symptoms of colon cancer.
Wow, know
So
your stool.
yes, unfortunately, yes, you have to look back.
Dr. Asante, such a pleasure chatting with you once again. I
Oh,
look forward
thank
to
you.
many more
Please, yes.
informative and educational
The
conversations
Cancer Society
like
is there
this.
for Trinidad and Tobago. You know, we've moved, so we're in Dundonald Street, and we have so many exciting things coming up this year for Trinidad and Tobago. But we really want to continue to impress upon you as a nation that prevention is better than cure, and screening is our fight against cancer. We
Thank
can't
you
be
so much.
fearful. Thank you very
More
much.
after this short break.